to the informational speech for public speaking. For my informational speech, I'll be talking about Cpap within the EMS system and its intended use. As an introduction, 1 in 5 adults today have mild obstructive sleeping disorder. Cpap is used to create a better lifestyle for these patients as well as treat respiratory and heart failure within the EMS field. We use Cpap devices on a regular basis for people having asthma attacks, CHF, anything like that. And we'll go over some of the indications and also contraindications for use of the device, and also when the device should not be used in relation to people with low blood pressure and things like that. First of all, what does Cpap stand for? Cpap stands for continuous positive airway pressure. It constantly forces oxygen into your airway with a constant pressure greater than your internal pressure, so it increases your internal intracavity pressure and causes some of that fluid to back up into your system and get back to the place where it's supposed to be. This is great for people with like pneumonia and stuff like that. It helps them breathe a whole lot easier as long as they can take it. According to Nancy Caroline's Jones and Bartlett Emergency Care in the Streets, which is the book for the paramedic program that they give us, Cpap increases pressure in the lungs, opens collapsed alveoli, and prevents further alveolar collapse, pushes more oxygen across the alveolar membrane, and forces interstitial fluid back into pulmonary circulation. It's a method of ventilation used primarily in the treatment of critically ill patients with respiratory distress, can prevent the need of endotracheal intubation. So it has a great part back in the day when all we could do was somebody having a big asthma attack or something like that, when we'd have to intubate them. Now, another option given to us is a Cpap machine. The structure of the Cpap machine, what it actually is it has several components. Cpaps are generally composed of a generator, a mask, a circuit that contains corrugated tubing, a bacterial filter, a one-way valve, and also it requires an oxygen bottle to have pure oxygen feed the machine. The therapy is typically delivered through a face mask that sticks onto your face. Straps come around the side so you can get a nice firm tight seal around the face so there's no air that leaks by, and all the positive pressure force is going into your airway and down into your lungs. The face mask is fitted with a pressure relief valve that determines the amount of pressure delivered to the patient, such as 5 centimeters of water. And this gets into PEEP, which we'll go into here in a second. This results in a high inspiratory flow and the need to push a pressure valve open with exhalation. So alert people who put this on sometimes feel uncomfortable because they feel like they can't exhale out because you're having to exhale over that pressure. So sometimes that kind of can be a contraindication, not necessarily, I don't want to call it a contraindication, because if those patients can handle it, it will absolutely help them out in the long run. And, yeah. So in the EMS field, we use 5 to 10. PEEP pressure is the therapeutic range that we tend to use. Depending on whether they're having an asthma attack or if we're using it for CHF values, we'll go to 5 or 10. So some intended uses for Cpap: sleep apnea. A lot of people just in the civil world will put this on at night when they go to bed, and it helps them, it kind of prevents them from snoring a lot of the times. A lot of snoring creates an obstructive airway, and they have irregular sleep patterns. That's what sleep apnea is. It's patterns of not breathing and then all of a sudden breathing, and it kind of helps that pattern regulate. CHF is congestive heart failure. It's basically when your heart doesn't pump blood as efficiently as it should. Can lead to some fluid leaking in places where that fluid is not supposed to be, and it'll help that. Respiratory distress, such as acute pulmonary edema, which is excess fluid in the lungs, acute bronchospasms as in an asthma attack, or COPD patients, which is a group of lung diseases that block the airway and make it difficult to breathe. Some contraindications for Cpap: respiratory arrest. If they're not breathing, obviously it ain't going to work. It's not a bag valve mask where you can force that pressure in. You're just going to be blowing pressure in, but you're not making the lungs actually work and make an exchange happen. Hypoventilation, if they have a low respiratory rate, if they're not breathing fast enough, usually this works really well in patients with asthma attacks that are breathing, 26 times a minute, because then it's that positive pressure and it helps get that volume of the air, oxygen down deeper inside your lungs and moves that fluid up. Inability to tolerate the mask. As I said before, some patients absolutely have a hard time. They feel like they can't breathe out. If you can convince them into keeping it on, it works great. Signs and symptoms of a pneumothorax or a chest trauma. This is simply because you're pushing all that pressure in. You're creating a greater pressure inside the thoracic cavity, and creating that greater pressure, you take a chance of puncturing your rib more, or you're trying to feed a deflated lung, which ain't going to be any good. Stuff like that. And low blood pressures, you also increasing that thoracic cavity, and so by increasing that, you're putting a little bit more pressure on the heart, which can decrease that blood pressure more because the heart ain't able to contract like it should be able to contract as hard. Improving effects, it's used along in asthma attacks with like albuterol and A&A treatment, something like that, so you're able to pump that medicine down deeper into the body. Like I said, according to Advanced Emergency Care and Transportation of the Sick and Injured, research has shown that there is a significant increase in morbidity and mortality when patients with these conditions receive intubation for the condition in the field. Early intervention with Cpap is an alternative means for providing ventilatory assistance and can prevent the need for ET intubation, thereby improving the patient's chance of survival. In conclusion, Cpap has become a part of normal operations within the EMS system to treat multiple airway diseases and reduce the need for endotracheal intubation. So that's the basics on Cpap and the intended use in EMS. These are where I got my resources from, and they're cited in my outline. Thank you.